how long ago did she have her amputation?
Only in November 23rd. So it's
That's when our dog did.
Oh, really?
Thanksgiving.
Yeah, it was the Monday before Thanksgiving is when she
Yeah.
had it done. I took her in on the Friday before, and he found the bone tumor in her leg, and he's like, bring her back on Monday. I need to get that off. And I'm like, what? Because I thought it was, she had bone-on-bone rubbing in that left hip, and I thought it was her hip. And so, well, he was hoping it was her hip.
Yeah.
So, and then it turned out to be the osteogenic sarcoma, which we weren't expecting that. Just because of how our x-rays looked, huh, Dr. Rosenberg?
Absolutely. Wrong location. Trying to figure out if she's uncomfortable here or whether that's just, she's just tired of doing this. It's not repeatable, so I don't see there's any obvious pain here.
I think it's just that she overworked it that day.
Yeah. So, and if you're at all concerned about that, we can do a week's worth of Paroxicam, which honestly might be safer and probably less expensive. So why don't we do the Paroxicam?
Okay.
We'll just do it for a week. You need to give it with food, just like with any non-steroidal, because it can irritate their stomach. And continue the rest, and let's see what happens. Now, obviously, we're trying to get weight off of her, and resting her is sort of counterproductive in trying to get the weight off.
And the steroid is going to be...
No, it's a non-steroidal.
Oh, it's non-steroidal.
So it shouldn't cause the hunger or no side effects.
Would be great.
Okay. I will go ahead and give you an anti-nausea medication, and just because it's the first time and everybody's a little nervous about the whole thing, why don't you just go ahead and give it to her for the next 3 days. If she's going to get sick, there's 2 different times that she could get sick. One would be between 24 and 72 hours from now. That's because we've affected those intestinal lining cells like we had talked about last week. Bland diet, that sort of thing. If she pukes once or twice, it's no big deal, but if she can't hold water down, then we need to see her.
Okay.
She could get a little soft stool. Again, the brat diet works great just to help with that. The second period of time she could have side effects would be 7 to 10 days. And some dogs, 14 days.
Well, by 14 days, she's going to be back here for the next one.
She will be. So we'll know what her white blood cell count is. Because the second later period, if they get sick, it's because they have too few white blood cells. So in a week, I'm going to ask that you either come here or somewhere just for the nurses to draw a quick blood count and make sure that her white blood cell count is in the safe range. And then I'll see you 2 weeks after that. Now, if 2 weeks after that her white blood cell count is still a little on the low side and I'm uncomfortable, then for her we'll do her treatments every 3 weeks instead of every 2 weeks. There's no difference in survival time that's been shown to go between 2 weeks and 3 weeks.
She gets those eyes.
What smell? It's just a syringe. All right, sweetness.
Okay, can you go, girl?
I'll be right there. She's fine, actually.
They can't really feel it, can
They have less nerve endings here, so I don't feel it as much. Yay! Thank you! Drug dose is 300 milligrams per meter square. We enter that, and then it calculates our drug there. This guy's gonna have a very large syringe. This is the one drug that when we're pushing it, this and adriamycin, we usually, in these big dogs, we use these big syringes because he's getting a lot.
you didn't have any treatment for your dog that was 8
Right.
and got diagnosed. And hers is not in her chest, so that was the first thing to do.
Okay.
So it gives me hope that that we can extend her life to be at least 7 or 8 years old would be nice, you know?
We've had one dog on there that she's been in remission 5 years from osteosarcoma, and you never hear that. 5 years.
That's good, that's the,
Yeah,
and see, well, she says she's got one that lived to be 7, Winston, is that his name? She said she had one here that lived like 7 years, treatments and stuff like that.
It's okay, we're almost done. We're almost done.
Good.
We're almost done, bee.
I had to use a little bit bigger catheter because we'd be here all day, Mama. Trying to push this through.
You're